travel restrictions are now being considered worldwide. 98 people have tested positive for a new virus strain.
This story reveals the indomitable spirit of the staff and patients in the capital city of South Africa.
This is patient 0, and she's the first patient that we've admitted with the COVID infection.
Extensive COVID-19 pneumonia.
The physician already phoned us to prepare for the worst.
There was a time when literally patients would just die. A lot of people who are dying require that human touch, and COVID has taken that away. Somewhere there is a light at the end of this tunnel. Let's hope for the dawn to break.
Good afternoon to those of you watching, and thank you for joining today's live stream. My name is Tiaan de Jager. I am the Dean at the Faculty of Health Sciences at the University of Pretoria. 0 to 0, which aired last night on Mnet, is a documentary created over 15 months during the COVID-19 pandemic. It offers an unfiltered look at what it's like to be a healthcare worker in the grip of the pandemic. It follows the staff of the Zuid-Afrikaans Hospital, a 100-year-old private non-profit hospital in Makkelneuk, Pretoria, when they admitted their first COVID-19 patient in June 2020. Somewhere, there is a light at the end of the tunnel. We have to believe it. Let's hope for the dawn to break, are the words uttered by Dr. Yanile Nyusulu in the new documentary. Today, we will find out, after this documentary has aired, its dawn, if the dawn will break indeed. Joining us for this discussion today are Professor Leonie Scholes, who co-directed the documentary, Dr. Inyani Nyusulu, and Professor Veronica Uckerman, who play vital roles in this documentary. A bit about Professor Leonie Scholes. In 2011, she was appointed as extraordinary professor in radiology at the University of Pretoria, where she has collaborated with various UP departments, example, cardiology, thoracic surgery, and nuclear medicine. In 1993, Leonie started her own private practice at the Pretoria Heart Hospital, which has expanded and now operates from multiple large hospitals and teleradiology sites in Gauteng, Limpopo, Mpumalanga, and the Northern Cape. Such is her passion for taking pictures that she has always found the time to fit in some photography throughout her demanding medical career. Given her academic bent, Professor Leonie Scholes delights in the position of imaging the human body as a medical subject matter through radiology, imaging it an art form through pictures. Professor Scholes won various awards for her photography, was runner-up in the South African Medical Association photography competition, won the first international award for Global Arctic Award competition. Her photographs of Arctic terns fighting were exhibited throughout Europe and Asia at multiple exhibitions. In 2014, she was one of the winners of the SAMA Photography Awards. Leonie has practiced in group exhibitions and in Pretoria and Stellenbosch, Art of Cancer, and she was also a participant in the portrait art exhibition, which took place in 2015 at Stellenbosch Word Fest. She completed a PhD under the supervision of the late Professor Anton Stolz and is in private practice with a particular interest in cardiovascular imaging. Our other guest, Professor Veronica Uckerman, is a physician in the Faculty of Health Sciences and Steve Biko Academic Hospital. She is an adjunct professor in the Department of Internal Medicine at the University of Pretoria. She currently leads the clinical COVID-19 response team for Steve Biko Academic Hospital and is acting head of infectious diseases. Professor Uckerman is involved in numerous research projects looking at novel diagnostics, clinical outcomes, and immune responses to the SARS-CoV-2. She works as a frontline clinician on the hospital's COVID-19 service response team. I want to salute her for her dedication, her hard work, and for looking after one of our senior executive members over an extended period, also at Zuid-Afrikaans. Dr. Yanila Nyesulu was born in Malawi and came to South Africa at the age of 7. She attended her primary and high school at St. Mary's School for Girls in Waverley. After matriculation, she pursued a Bachelor's of Science degree at the best university, obviously, the University of Pretoria, and graduated in 2001. She furthered her education by obtaining a second degree, the Bachelor of Medicine and Surgery, also at the prestigious University of Pretoria, and completed her internship and community service at Natalspruit Hospital. She has worked as a casualty doctor for 2 years in Linksfield Hospital and then specialized in internal medicine at the University of Pretoria. Here she obtained her fellowship degree for the College of Medicine and completed her Master's in Medicine in 2018. She is currently working at Zuid-Afrikaans Hospital in Pretoria, where she has her private practice. Before we begin with the discussion, a friendly reminder to our viewers to post their questions and remarks in the comment section, which we will address later on during the session. Professor Scholes, could you please give us a bit of background why you filmed this documentary?
Well, thank you, and thank you for having us here, Professor De Jager. When the pandemic started, I immediately realized that this is the most catastrophic event in my career, in my medical career, and I think possibly in all the medical healthcare workers' careers, and that there was no way that people would be able to see what we as healthcare workers experienced. And thinking back to the footage that we've seen from the First and Second World Wars, even the Holocaust has been documented. 9/11, we recently saw revisits to that occasion. But we were called the new front line, and the healthcare workers certainly were the brave warriors, but nobody saw it. Nobody had access to it. And having photographic skills that I possessed, and also being in the unique, unprecedented position of being able to document it, I realized that I had to. This is suddenly expanded into a larger project that I actually initially anticipated, but still I simply felt obliged, as I said in the documentary, to document it, and I actually had no option. I had to do it.
I remember when you first mentioned this to me, and yes, I don't think you realized at that stage what you're up for. But what were some of the challenges you had to face in the production of this documentary, starting with working in an unsafe environment?
Well, firstly, that was a huge problem. We had to take, I asked, soon after I started, I asked one of my friends, a photographer, Shem, and this was a joint effort between 3 people, it's not only me. I asked Shem to join me, and we had a challenge in the fact that this was a contaminated environment. We had to work with cameras, we had to adhere to the rules of our infectious disease manager. She's a very good, strict sister. So every time we took cameras in, we had to sterilize it or put it in quarantine. We were scared to contaminate ourselves, to contaminate our families, and to expose our other colleagues. When I went back to the radiology reporting room, that was a huge challenge. Other challenges, if I may continue, Professor,
please.
Is the fact that we had to adhere to the ethical considerations. This is a very sensitive topic. We filmed people, and I'm talking about patients as well as healthcare workers, under huge stress. Firstly, talking about patients, we filmed patients in very vulnerable situations. And as the philosopher Susan Sontag said in her book on photography, which is the philosophy of photography, it's actually an act of violence. When you film somebody, you take some moment from their lives, you take it. So it's an act of violence. So we had to be very sensitive towards the patients and also sensitive towards our colleagues. I was really into their face with a camera, so being sensitive to the vulnerability and the sensitivity of the situation, and taking into consideration privacy and the ethical issues.
Well, I think you did an amazing job by taking all those aspects into consideration and came up with something true and not sensational. So to the team, well done. I think the University of Pretoria, so proud of you. Professor Uckerman, what impact do you think it had in the fight against COVID-19?
Thanks for having us, Prof. de Jager. I think there are various levels at which this would impact. I think for the broader community, they never had the privilege of seeing what we see every day in the ICU. It might have demystified it a little bit. It might have added some names and faces to the stats. Suddenly, a number of deaths or a number of admissions becomes a mom, becomes a brother, becomes a sister. I think also it added something for the healthcare workers. I felt very frequently like they felt they weren't being seen, like we were fighting this battle, and especially nurses who were spending hours at the bedside, and then they would go stand in a queue and see people not wearing masks. It was a very, I think it made it real, and I would hope that that really impacts people to realize that this is real, the kind of suffering and the kind of fear that people experience in the ICU and under these highly stressed circumstances might make them rethink their attitude towards what we have in place, towards vaccinations, towards the restrictions that people have been very uncomfortable about.
Talking about the vaccines, and I would like to get both Professor Scholes and Professor Uckerman your opinion about it. Do you think if vaccines were developed earlier, then that it would have had an impact on how the documentary would have turned out? Let's start with you, Leonie.
I think it possibly could have. I think we definitely know, it is scientifically proven, that vaccines protect us. So if the vaccines were rolled out earlier, less people would have ended up in ICU, because at this stage only the people who are not vaccinated, not exclusively, but most of them are not vaccinated. So maybe the whole pandemic would have panned out differently, and our footage of it would have naturally as well. So yes, unfortunately it wasn't possible, but I think it would have changed it, yes.
Veronica?
Prof, if you asked me the same question in January and February, I would have said definitely yes. Because at that stage, we were all waiting for the vaccine to come and change what we were seeing. And none of us imagined that there would be the kind of hesitancy that we are seeing. So my answer is a little bit more reserved now, because if it was available, would people really have had the same response and slow uptake that we're seeing now? If there was uptake, it definitely would have changed the face, especially of our last wave.
Yeah, and for some obscure reason, there's this hesitancy. And I'm sure you, working on the front line, find it difficult to understand. But Dr. Janila, healthcare workers are asked to go out above and beyond all duties. You experienced in, I think, this last year and a half, 2 years during the pandemic, even more so. And specifically the workforce, and to keep them safe. How do you define the subject of social relevance?
Thank you again for having me, and would like to thank Prof. Scholz for actually doing the documentary, because from what we know from the pandemic, from when it all started, there was a huge pressure that was put on from the WHO, from all the different governments, to say that society is responsible for keeping at home and staying at home until they have more than mild symptoms, and that they should only present to the hospital when they are really, really ill. And that was put in line together with the other guidelines to say, do not socially distance yourselves and put on masks when you're in public, don't congregate in large crowds, etc. And all of these measures were put about to protect the healthcare worker, to protect the general society. And in this particular situation that we find ourselves in, we see that the same kind of pressure is put on society. So society has to now learn how to protect us even further by taking responsibility and doing the correct thing, which is to vaccinate. If you want to decrease the amount of numbers of patients who are actually getting sick and presenting to hospital and putting us at risk, then society has to take the onus on themselves and do the responsible thing and vaccinate. Another thing that society has to also understand is it's imperative to protect each other from wrongful, or let me rather say, it's important for society or members of society to responsibly share information, whether it is on social media, different types of social media. If you're going to share something about the virus or vaccination, be responsible and take responsibility for what you're actually doing, propagating the correct message and not a dangerous message which could potentially harm your fellow man. So that is my take on that.
Absolutely, because all of a sudden there's all these experts.
Yes.
Dr. Janila and to Professor Uckerman as well. How does this documentary address and reveal the insufficient preparedness to protect healthcare workers in an event like a pandemic? So it is a bit of a difficult question, I suppose, but you experienced it.
Prof, I think none of us, or the whole world, was not prepared for this pandemic. Perhaps we thought that it wouldn't hit us as badly, and we had all of these ideas about how we would be somehow safer than what happened in other countries, but it didn't turn out that way. So when we were exposed to the pandemic hitting us, we were all terrified. And we were ill-prepared because we didn't know what to expect, and there's no guideline to tell us what to do for this particular pandemic, how to treat your patients, how to prevent ourselves from getting infected, etc. So we were all completely ill-prepared for what we actually saw. No one prepares you and says, during a pandemic, this is what you're going to do, this is what you're going to expect. And the numbers of patients that came through, the amount of death that we saw. We can't go to school and someone teaches you how to prepare yourself for something like that. The amount of stress that we went through, the pain, the sorrow, the fatigue that was associated with this, onslaught on society was incredibly devastating for the healthcare worker, and we were ill prepared for it completely.
I had the same question in my mind during those peak areas, where I sometimes wonder, when do you sleep? Do you go home? So I really salute you for doing an amazing job. And I think the faculty at Health Sciences, and in the country, everywhere, the commitment, the hard work that went into it, and still, to fight this pandemic. Professor Uckerman, share your opinion with us on that point as well, please.
Prof, when you first asked this question, I was reminded of a conference I attended 2 years ago, and the ethics talk was on pandemic preparedness. And to be honest, I pulled out and did some emails while I was listening. So none of us, like Yanela said, none of us really thought this was coming. And in terms of protecting healthcare workers, I think first of all there was the initial fear of PPE and adequate protection, and we had to come up with some really creative things to bypass that and procure what we needed. But I think in terms of where we've probably failed healthcare workers is that kind of mental support. Like Yanela said, there was a lot of tiredness, fatigue, things that we generally deal with on a much smaller scale. And when my first registrar came to me and clearly needed help, I had to scramble and think, where do we find the help? What about the mental health? What do we actually usually do for the mental health of healthcare workers? And I think this has really been one of the things that's been highlighted in this pandemic.
Dr. Yanela, tell us a bit about the experience of patients in isolation. What kind of mental challenges, we spoke a bit about mental challenges now, do both the patient and the healthcare worker face?
Well, I can only speak from my personal experience, of course. In my ICU, we see a lot of patients who have just gotten the new diagnosis. Now they're COVID positive, and we do all the things that we need to do to isolate them, to protect themselves as well as us. And we separate them from their parents or from their relatives because we need to keep the environment safe. So the patients come in, first of all, and they've got this diagnosis, it's a new diagnosis, and they are feeling vulnerable. They're feeling alone. They are completely terrified of this new diagnosis. Everybody hears the word COVID and they think, am I going to die? So it plays on their minds, and every single sound, whether it is the beeping of the monitors or the saturation, I always find patients like staring at the monitors and they're thinking, what is my saturation? Is it going down? And they're checking every 2 seconds because they're anxious and they're terrified. So mentally, they are completely unstable in the sense that they're so anxious about the diagnosis, about what's going to happen to them. And being in the new environment, separated from your family, it's even worse. I think we go a step further because of the fact that the sounds actually affect the patients. We actually even go a step further and take their cell phones away because now the beeping of the messages that are coming in affect the patient's mentality or mentation as well. Patients are they get inundated with information. They don't want to hear that someone has died. Someone beloved to you, your next door neighbor, whoever it is, has died, and they get all these messages, and phone calls, and then it affects them mentally because then they start thinking, will I make it? And I think that is one of the things that we have to understand, that this is not just a normal isolation. This is a different type of isolation. This is an isolation associated with fear and anxiety and personal loss. They tend to, some of them, when we take them off the ventilators, most of them actually hallucinate, and they start to behave erratically, and they're aggressive. We see it a lot in the ICU when patients are coming off the ventilator. And those particular patients, we take extra care, and give them that little extra bit of TLC, because they really are suffering from something which is unknown to them. And all the information that is fed unto them affects their normal, way that they would normally react to information. So I think we treat them kind of like babies to protect them in that environment and get them through that environment and take them out. As for the healthcare workers, it is, and I think Prof will elaborate if she would, healthcare workers are suffering from the fear, first of all, of the disease. They're exhausted. They literally work from, and I'll talk about the nurses, they'll work from 7 till 7, and then the shift doesn't change until after the next person relieves them. Some of the nurses don't even pitch for work because they're so tired, they're completely fatigued after the 7 days. Some of us as doctors, as specialists, we go in and out of these rooms, and we are exhausted by not only the number of patients that come and that crash on you. Mentally, it weighs on you because you are responsible for so many people in a critical situation or in a critical condition, and it weighs on you heavily because you are responsible to get them back home. So it kind of, it affects us in that way negatively, but we feel like we have to be the strength for everybody, because if we crash as the head of the unit or the head of the team, everybody else is going to possibly collapse in that. So the onus is on the doctors to be stronger than everybody else and to keep everything going. And that can be a little bit challenging sometimes.
I must congratulate you, because I think this is a first in the world where people get a snapshot of what is really happening on the inside. And just by reading some of the emails this morning after 0 to 0 was broadcast last night, I got emotional because you touched people with it. People that lost family members and others that could understand something and say, for the first time, I understand and now it's okay. So I think you really helped a lot of people by doing this. And I'm sure it was not easy always. Professor Scholes, tell us about the alliances and the new friends formed with the clinical staff that facilitated the making of this documentary. I'm sure you come in contact now with people that you would normally not have.
Certainly, Professor. I think, well, a famous radiologist once said that when you're a clinician, you see a patient and you imagine the pathology. And when you're a radiologist, you see the pathology and you imagine the patient. But my clinical years were quite long ago, but this was quite a personal journey back into the bottom of why one becomes a healthcare worker. Or the initial reason for doing medicine, and I think we all were idealistic, and hopefully we still want to do the main thing of curing disease and helping people. So I got back into the clinical side of it, and I literally now know every single person in that hospital, and they call me on my name, and I know who they are. And that was a wonderful experience once again, and I've made friends with Janila and Veronica, because it was a very personal journey, and it still is a very personal experience. But all of a sudden I was thrown back into the area where they do the sanitation, and it's a bad thing to say, but where they take the corpses who've got COVID. I know who deals with that. I know a name. I became friends with the head of the ICU, with the head of the nursing staff. So it's been a very personal journey back, maybe into the roots of why I've done medicine. And certainly, I once again appreciate the role of the clinical side. We as radiologists, I think we play a very important role in diagnosis, but I think the clinical people are amazing, and just to see what they've been going through has been a very emotional thing.
I'm sure. And Professor Veronica Uckerman, I think our students learned so much from it. And you were there next to them and still to support them and to look after them, in addition to the hospital and your patients. So to some extent, they've got an advantage, I think, prepared for future pandemics. But I think to many, it might have been a wake-up call as well, hey? How do you think the vaccine will bring the dawn, as it was put in 0 to 0? Is there hope, Dr. Janila?
I definitely think that there's hope. We've seen the difference so far. There's definitely hope. We have to believe it. I think everybody needs to understand that if we don't believe that there will be a future, there will be no future. If we believe in the vaccine, that the impact that the vaccine will have, it will obviously have a proper impact. I don't know if that makes sense, if I'm saying it correctly. But what I'm trying to say is the patients who we have seen who have been vaccinated and come in and they have been newly diagnosed with COVID are few and far between. I have personally only admitted 3 or 4 patients who have had vaccinations and within the 2 or 3 weeks or between the 2 vaccinations have presented with COVID, and they don't have severe symptoms. They stay in hospital for a couple of days and then we discharge them. Only one of those, of my patients, was actually intubated for about 5 days and then they were off the ventilator and they did very well. So will the dawn break? Yes, the dawn will break. Do we believe it, that the vaccine is the reason for this? I think so, because we can see it in the work that we do. We're seeing it on a daily basis. So I have to believe that the difference in what is going on is the vaccine, because nothing else has changed in what we do.
Professor Scholes, how does this documentary enforce a call to action to the lives of healthcare workers? And was it intentional?
Well, I think if I speak about the healthcare workers and their call to action, it happened before the documentary already. We saw people who were retired who came to do vaccinations. But hopefully, if I can say that we can maybe aspire for a new respect for healthcare workers. And for people, it'll inspire possibly the will to want to become a healthcare worker, and for healthcare workers, once again, to feel very proud of what they're doing. Maybe this will also show the rest of the world their worth. So yes, I think if I can hope for this documentary to restore a lot of respect for the healthcare workers. Unfortunately, it has been lost along the way in some aspects of it. So yeah, I really hope that that'll inspire young people and students to study healthcare sciences, to become nurses. So I hope so.
Thank you. And thanks to our listeners that's sending in questions. We've got one. What would you say to anti-vaxxers after what you have experienced and been through? And then they add, thank you for being a #life changer. So maybe Professor Stolz.
Well, I think certainly initially the anti-vaxxers made us go into an argument or enter into a discussion. Lately, those of us who've really been in the front line have become a bit impatient, and we react almost aggressively because it's scientific. Vaccines work, and they keep you out of ICU. You can still get the disease, but you don't go to ICU. So yes, we're very impatient with them, and so we should be, because there's scientific evidence for that. So I could just tell them, please watch the documentary and think for yourselves Do you want to really be admitted into one of these wards, being intubated? Yeah, so that is definitely my response to them. Just watch it, and you will see that this is not a hoax, and this can be prevented.
Another question that we received, Professor Uckerman and I had this question several times in my mind. How did this documentary impact your personal life as a professional and a member of the community?
So when Leonie first approached me about this documentary, I don't particularly like cameras. I remember thinking about it and thinking, we don't actually know what's going to happen in the months to come. And actually wanting to have something that, should we not make it, there would be something for my family to see. So it has impacted profoundly. I mean, watching it yesterday was emotional for me because it was almost like a bird's eye vision of what's been happening in my life, and the impact of that on the people around me has been profound. But on the other hand, it's been such a privilege to let people into that space, and I hope it's not a wasted privilege, because the aim of this is really to get people to start working towards change. And we've mentioned vaccinations every time and just about every question, but that is what it's about. It's about getting towards some kind of normality for us, getting to a point where our families get to see us again. So it's been a profound journey, a lot of introspection, and Leonie was really there in our faces and made us face some really pertinent issues.
Dr. Janila, we know that photography is a passion and a hobby for Professor Leonie Scholes. But now the question to you, what was your mindset knowing the risk of filming this documentary? Were there any doubts?
About the documentary itself?
About it.
There were a few doubts because I actually thought that this was just going to be something very small, and it was just going to be a documentation for what's happening in our hospital for us to peruse around. So it wasn't really big for me. I didn't think that it would have such an impact that it's having. I didn't understand the power of people wanting to know what goes on in the hospitals. And I didn't think that the documentary was even going to, be finished, so to speak, because Leonie called it 0 to 0, and we were so excited, and we were like, okay, 0 patient 0 to patient 0, and we were so excited. So we thought that at the end of the first wave that this was going to stop. And it didn't. And it impacted all of us because we were taken aback by the whole situation. We were devastated that it was going to carry on and our lives were going to continue to spiral as they have done. And we were not going to see the end. So that's why I thought that this documentary wasn't going to be finished. But I'm glad that it was done, and I'm glad that it has had the impact that it has had, because I really hope that people see what we have gone through and what we as a small group of people, as a small hospital go through, that, if it will have some sort of an impact on the greater population.
It's amazing that you took the positive side from the 0 to 0 and see the 0 patient there. It must be in your DNA. I think this is about what we've got time for, and there will be many, many more questions. But before we end today's session, I'd like to thank Professor Leonie Scholes, Dr. Janila Nyasulu, and Professor Veronica Uckerman for sharing their experiences with us throughout this documentary. It's very personal as well, as you've mentioned, and for playing such a vital role in the fight against the COVID-19 pandemic. You are real life changers. A special thank also to the University of Pretoria's Faculty of Health Sciences for affording us this platform. And finally, thank you to our viewers for watching. We trust that it has been an informative session to you. Be sure to follow us and subscribe to all our social media platforms such as Twitter, Instagram, Facebook, YouTube, and LinkedIn to stay up to date with research findings as well as further developments in the field of health sciences. Please stay safe and remember that your health is in your hands. Please vaccinate.
Vaccinate, 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 vaccinate. It's not too late, don't procrastinate. Vaccinate, 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 vaccinate. It's not too late, don't procrastinate. Vaccinate, give it a beat, vaccinate, instead of defeat. Vaccinate, give it a beat, vaccinate, vaccinate, give it a beat, vaccinate, instead of defeat. Vaccinate, give it a beat, vaccinate. Hey, everybody, look, they call me the boss. The name is Ross, giving out information free of cost. Let's talk about the contemplation we're facing on vaccination. Help the dying generation vaccinate. Let us try to heal the nation. Wait, but there's a debate. People are wondering why we should vaccinate. First of all, prevention is better than cure. Second of all, getting the vaccination is not mandatory, but it's mandatory for you to know it's your responsibility to keep you, your family, and community safe. So do the right thing and vaccinate. Vaccinate, 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 vaccinate. It's not too late, don't procrastinate. Vaccinate, 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 vaccinate. It's not too late, don't procrastinate. Vaccinate, give it a beat, vaccinate, instead of defeat. Vaccinate, give it a beat, vaccinate, vaccinate, give it a beat, vaccinate, instead of defeat. Vaccinate, give it a beat, vaccinate. Many are afraid of the vaccination due to the miseducation like Lauryn Hill. No disrespect, but we will get entangled if bad news escapes like a bird in a cage. But what we want to do is put corona in a cage. The vaccine is safe. Anybody can take it from the individuals with autoimmunity, comorbidities, living with HIV. It doesn't even have an effect on your fertility. The only ones exempted from taking the vaccine are pregnant women and children and those with previous allergic reactions to an mRNA vaccine. Vaccinate, 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 vaccinate. It's not too late, don't procrastinate. Vaccinate, vaccinate, vaccinate.